Hello students, this is the next topic of unit 2nd, hormonal regulation of blood glucose level and diabetes mellitus. In this topic we have to discuss how the blood glucose level is regulated and what are the metabolic disorder of blood glucose level. So, what are the hormones which are secreted by the pancreas and how they affect the blood glucose level and how they can manage the concentration of glucose in the blood sugar level. So, you all knows about that pancreas secrete insulin, glucagon and somatostatin. Pancreas is basically responsible for the controlling of this blood glucose level, and the alpha cells of the pancreas secrete glucagon, which is basically regulate or elevate the level of glucose in the blood, and beta cells of pancreas helpful in secreting insulin, which decreases or devastate the level of glucose in the blood, and the delta cells of pancreas which are helpful for the secreting somatostatin, which can control these both alpha and beta cells. So, delta cells or somatostatin is helpful for the conversion or the secretion of insulin and glucagon from the pancreatic cells. So, F cells is also secrete polypeptide here that inhibits the digestive enzymes which are produced by the pancreas. So, basically in regulation of blood glucose level, we are just remember about alpha and beta cells, because one cells secrete glucagon and the other cell is secrete insulin. The both are having the most important role in blood glucose level controlling. So, there are what is the blood glucose concentration? The normally blood glucose level, amount of glucose is measured by the milligrams per deciliter of the blood. So, it is the normal blood glucose level at fasting condition is 100 to 60 to 100 milligrams per deciliter, and postpartum or after lunch, after taking food, it 100 to 140 milligram per deciliter. So, this is the normal, and after lunch, after taking food, these are the basic range of blood glucose level, which is knowing that the blood glucose level is in normal condition. But in the condition when the blood glucose level is increased, then there is presence of insulin here, which secrete from the beta cells of pancreas to reduce the blood glucose level, and when the blood glucose level is reduces from 60 milligram per deciliter, then glucagon is released from the alpha cells of pancreas, and that helpful for the formation of glucose from the glycogen. So, what is insulin and how they affect the blood glucose level? Insulin is a peptide hormone which is secreted from the beta cells of pancreas. It is basically regulate the metabolism of carbohydrate and fats by promoting the absorption of glucose from the blood to skeletal muscles or fat tissues, and thus it causing fat to stored rather than to used energy. So, the main purpose of this insulin hormone is to regulate the amount or level of blood glucose level, or it and promote the absorption of glucose from the blood to skeletal muscles and fat, and that is why it promote the storage of fat as comparison to this glucose here. And what is the tissue of origin of this insulin is pancreatic beta cells, and what are the metabolic steps? Metabolic effect of insulin is they enhance the entry of glucose into the cells, and it also enhance the storage of glucose to glycogen in so that glycogen or conversion into the fatty acid. It's promote the conversion of glucose into the glycogen or promote the conversion of glucose to fatty acid, so that the amount of blood glucose level is reduced or to be the normal level. And it also helpful in synthesizing the fatty acids and protein synthesis, and it suppresses the breakdown of protein into the amino acids and adipose tissues to the free fatty acid, because these all are helpful for the increasing the blood glucose level. So, it reduces the breakdown of protein into the amino acid, and it is also suppresses the conversion of adipose tissues into the free fatty acids. So, what is its effect? What is the effect of this insulin to blood glucose level? Insulin is helpful for the reducing the level of blood glucose, so in the body. So, it basically stimulate the liver to convert glucose into the glycogen, which is we already discussed in the last lecture, where we have discussed about the glycogen metabolism, where glycogenesis having the conversion of glucose to glycogen, so that higher amount of glucose is present in our body due to our food or diet condition. So, whenever their level of blood glucose is increases, insulin release from the pancreatic cells, and they can promote or exacerbate the conversion of glucose into the glycogen, so that excess amount of glucose is converted into the glycogen in the storage form, so that the normal level of blood sugar continue. So, it increase the glucose transport into certain cells like muscle cells and liver. So, and it results from the insulin mediated protein increase in the number of glucose transport protein in cell membrane. The main target, the main function of insulin to reduce the blood glucose level to normal, and excess amount of glucose is converted to different stages. It either goes towards the formation of glucose, or it is transferred towards the muscle cells or in liver. So, this is the main action of the insulin. So, it remove glucose by circulation, so that its diffusion facilitation is the main work here, and insulin bind to target cell via insulin receptors and signal transduction. So, whenever we will take the any type of food, or we will take a diet, so blood glucose level increases in metabolic conditions, and after that the pancreas, whenever the blood glucose level is increased, pancreas release insulin. The pancreatic cells release insulin. In response to release of insulin trigger liver to convert this excess amount of glucose to the glycogen, and this excess amount of glucose is converted into the glycogen. The level of blood sugar is reduces, and whenever the blood glucose level is reduces, the pancreas release glucagon and stop releasing insulin, because level of blood sugar reduces. Then pancreas start secreting glucagon, which is responsible and trigger liver to convert glycogen into the glucose, so that level of blood glucose control. So, this is the main action of the insulin here. And what is the glucagon? Glucagon is also a peptide hormone, which is synthesized or produced by the alpha cells of pancreas, which helpful for increasing the blood glucose level in the blood. Its effect is just opposite to insulin. So, they are work opposite to each other. So, insulin reduces the blood sugar level, and glucagon increases the blood sugar level. So, when pancreas release glucagon and the condition of releasing of glucagon, then whenever the body realize that the blood glucose level is reducing, and pancreas trigger alpha cells of Langerhans of pancreas, and these alpha cells release glucagon, and glucagon trigger liver convert or break down of glycogen into the glucose, so that the normal level of blood glucose is rises, and there is when there is need of glucose in the blood is controlled by this action of this glucagon. What is the tissue of origin? Alpha cells of pancreas. What is their action? They enhance the release of glucose from glycogen, and it also enhance the release of glucose from the free fatty acids or amino acids like gluconeogenesis, which we already discussed in the last chapter. So, the main purpose of glycogen is to increases the blood glucose level, increases the concentration of glucose in the blood. So, what is the effect of insulin glucagon to blood sugar level is rises or increases. It utilized when glucose is utilized by all the cells of the body, muscle cells, and so glucose is utilized as energy by the muscles and released into the circulation by the liver cells. This is the main work of glycogen. And the next is it stimulates the absorption of amino acids from the blood by the liver and helpful to convert the non-carbohydrate compound to the formation of glucose, which is known as gluconeogenesis. And the next is it stimulates adipose tissues to release fatty acid into the blood. So, the main purpose or main target of this glucagon is to increase the level of sugar in the blood or to normal homeostatic level, and this rising of blood sugar level inhibit when after the proper controlling of proper triggering of glucagon to liver, there is rising of blood glucose level. So, at that time pancreas stop secretion of glucagon and again started secretion of insulin from beta cells of pancreas, so that they can regulate each other. So, this insulin and glucagon work together to maintain the homeostatic blood glucose level. And the third one is somatostatin. What is somatostatin? This is also a peptide hormone which regulate the endocrine system. We can also know this growth hormone inhibiting hormone is also so this regulate the controlling of it regulate the release of insulin and glucagon from the pancreatic cells, and this is released from the delta cells of the pancreas, and they basically affect the transmission and cell proliferation by the interaction with the G protein coupled neurotransmitters or receptors, and it inhibits the release of numerous secondary hormones, and it also inhibits the insulin and glucagon secretion. So, tissue of origin is the pancreatic delta cells, and what is the action of this somatostatin? Because it affect both insulin and glucagon, so it having the blood glucose level reduces, it always controlling the insulin and glucagon, and the effect of total effect of this somatostatin into the blood glucose level, that it lowers the effect of blood glucose, and it suppress glucagon release from the alpha cells, and it suppress release of insulin, or it also suppress the other growth hormones, because it is known as growth hormone inhibitory action. So, it also stimulate the breakdown of glycogen to glucose in skeletal muscles. It is also helpful for the promoting glycogenolysis when there is reducing the concentration of glucose in the blood. And what are the metabolic disorders of this hormonal activity? There are two different metabolic disorders because of level based on the blood sugar level in the body. Two major type of disorders are present here. First is hypoglycemia and the second is hyperglycemia. the hyperglycemia, as the name itself said, what is hyperglycemia? Hyperglycemia is increasing the level of sugar in the blood. So, whenever there is excess amount of sugar circulate in the blood plasma, this is generally rises the blood sugar level. How much rises? More than 200 milligrams per deciliter. That this disorder is known as hyperglycemia. And the second one is hypoglycemia. In this hypoglycemia, the blood sugar level glucose concentration is fall below a level which is required to properly support the body in needs for energy and stability throughout its cells. Normally it is less than 60 mg per deciliter, but whenever then our body is not capable of controlling itself, or it level of glucose is such down that body normally not functioning well and energy of body is reducing, so that condition is known as hypoglycemia. Normally the level is less than 60 milligram per deciliter blood sugar level. And now the main disease which occurs with this hyperglycemia is diabetes mellitus. All knows that most of the families in India having the patient with the diabetes. So, diabetes is the basically metabolic disorder which characterized by the high blood sugar level, which is also associated with the different clinical manifestations. Diabetes mean polyuria, highly urine secretion of high urine with the increased sugar level here. So, in the most of the cases, the diabetes is increased when there is unable to produce insulin, or there is not working of proper insulin here. So, there are two types of diabetes mellitus is present here. In the first is primary and the second is secondary. The difference between the primary and primary diabetes is unrelated to any type of disease. Koi disease is not correlated with this thing. It depends mainly on the diet, or it depends on your normal physiological conditions, normal condition you are going towards that particular condition. And the second one is the secondary diabetes occurs due to the damage, or there is any disease of pancreas which is not able to synthesize or secrete insulin so that normal blood glucose level is controlled by the help of this insulin. What is the classification of this diabetes? So, basically diabetes is classified into the two types, type 1 diabetes and type 2 diabetes. The type 1 diabetes is due to the deficiency of insulin or destruction of beta cells in islets of pancreas or islets of Langerhans. The first type 1 diabetes mellitus is basically known as insulin dependent diabetes mellitus. It is totally dependent on the secretion of secretion of insulin. Reason, there is any destruction of pancreas, there is any destruction of beta cells, or there is any abnormality present here for the releasing of insulin from these beta cells of Langerhans of pancreas. So, this may occur any age of life, but it is usually occurs in the 40 years of age, and in this condition the patient require only basically insulin injection here. So, that whenever it require insulin injection, and after using insulin injection it can control easily. And when this type 1 disease occurs in the in that period, or in infancy period or in childhood condition, this diabetes is also known as juvenile diabetes. This diabetes is rapidly develop and progress in the rapid rate but this is also correlated with the acidosis and ketosis also, because the reason, the main the reason is degeneration or beta cells, degeneration of beta cells, or destruction of beta cells by any viral infection, or koi congenital or genetic disorder of beta cells. Is there any destruction of beta cells in the autoimmune disorder, any disorder, any genetic disorder, any viral infection is responsible for the destruction of beta cells, or due to the any type of antibodies which are produced due to the antibodies produced against these beta cells, which are responsible for not releasing insulin from pancreas. And the next one is type 2 diabetes mellitus. Type 2 diabetes mellitus is known as non-insulin dependent diabetes mellitus. In this diabetes, there is no dependency of insulin, because this is due to the insulin resistance. In the body, there is resistance against the insulin occurs. So, what is the reason of this insulin resistance? There are failure of insulin receptors to give response to insulin. Insulin is secreted in the body, beta cells is secreting the insulin, but insulin receptors are not able to take action after insulin releasing, and they are not able to use insulin. Insulin is not able to give the action to liver to convert higher amount of glucose to glycogen. So, this 90% of diabetes patient have the type 2 diabetes mellitus, and usually occurs is the 40 years of age, and only very little amount of patient having the urgency of use of insulin injection, because insulin is already secreted by the cell whenever there is increasing the blood glucose level in the body. So, pancreas release insulin, and insulin is not properly working, because receptor of insulin is not able to take action after insulin release, because they showing resistance to insulin. So, in this type of resistant or this type of type 2 diabetes mellitus, mostly oral hypoglycemic drugs are helpful, like glibenclamide, tolbutamide. These oral hypoglycemic agents are helpful for controlling this type 2 diabetes mellitus, because insulin is not helpful here. Insulin is secreted by the body, but is not controlled by the body here. And basically it is often associated with the obesity, or it is high overweight due to the overweight, but is not easily correlated with the ketosis or acidosis. There is no increasing the acid condition, or pH is reducing in the blood. So, there is no this type 2 diabetes mellitus is not associated with the ketosis or acidosis. It is basically correlated with the atherosclerosis, any type of heart diseases, or there is increasing overweight situation here. So, this in this type of diabetes, the structure and function of beta cells is normal, there is no destruction, and the insulin receptors are maybe less, maybe absent, or maybe abnormally working in the showing the insulin resistance here. And the other form of the other form of type 1 diabetes mellitus is here. Latent autoimmune diabetes is in adults. This is slow onset diabetes and having the slow process of insulin dependent diabetes mellitus, and it occurs the patient with the more than later age of life, like 35 years of age, and it may be difficult to distinguish this latent immune diabetes in adult with the insulin dependent diabetes mellitus, because pancreas here take the long time for controlling or stopping insulin here. The second is maturity onset diabetes in young individuals. Here it is a very very rare form of diabetes, and it is inherited or genetic disorder, and due to heredity defect insulin secretion is not possible in such type of patients, and what are the main cause of insulin resistance. The insulin resistance having the main causes, the first one is genetic disorder, genetic disorders like factors causing type 2 diabetes mellitus, or lifestyle changes like bad eating habits, having physical inactivity, or having more obesity. Your physiological condition is basically responsible for insulin resistance with the genetic disorder here. So, these are the hormonal regulation of insulin and glucagon, diabetes mellitus and their resistance. Thank you.